Welcome back. I'm now joined by BJP spokesperson and a professional doctor, Sambit Patra, Delhi's former health minister and former Congress MLA, Kiran Walia, Aam Aadmi Party spokesperson, Raghav Chadha, the vice chairman of Manipal Hospital, Sanjeev Bagai, the Secretary General of the Indian Medical Association, K.K. Agarwal, and the Vice President of the Public Health Foundation of India, Professor Ramanan Lakshminarayanan. Kiran Walia, both Congress and the BJP have claimed that the Delhi government is guilty of not properly handling the present outbreak of dengue. Given that A, dengue is cyclical, and B, that it peaks every 4 or 5 years, why are you blaming the Delhi government?
Precisely because they ought to have had a plan in place. We all knew that, this mutation and the reoccurrence of the dengue, and everybody was predicting that this time it will be taking a severe form. But at our times, we would be even consulting specialists like from All India Institute of Medical Sciences and other places as to what form it's going to take, what kind of preparations are we supposed to make. It's like being caught totally unawares as far as the present government is concerned, I'm sorry to say. But this is what was required, and who is paying the price is the citizens of Delhi. And there was no idea, they seem to have been caught totally unawares, as if from asleep. And when the whole thing has really become a total, turmoil.
Let me put that key point to you, Raghav Chadha. It was widely known that after the relatively mild outbreaks of dengue in 2011, 12, 13 and 14, dengue in 2015 was going to hit some sort of peak. You're guilty, Mrs. Walia says, of not planning in advance for this peak, not taking steps so that you are prepared for the problem.
Mr. Thapar, what has happened is that politicians from the BJP and the Congress are behaving in an irresponsible and an insensitive manner. There's an echo, please get it corrected. In an incivil manner, and trying to politicize this entire issue. As far as my government is concerned, Mr. Thapar, we assumed office in the month of February 2015. Can you get this corrected? In February 2015. And since that, our health minister and the government of NCT of Delhi has been working in order to ensure that proper healthcare facilities in Delhi are available. Now, as far as the number of hospital beds goes, we have increased the number of hospital beds in Delhi government-run hospitals by a whopping 300% if you compare it with what it was during the last year. We have made ample awareness, we've run ample awareness campaigns, we have run, campaigns for preventive healthcare, and we have ensured that medical facilities, medicines, tests, etc. are available in Delhi government-run hospitals free of cost. Even as I speak, there is facility available in Delhi government-run hospitals, and I urge your viewers to not panic. Lastly, let me say this, that in Delhi, there are number of layers at which healthcare functions. First of all, there are 5 different types of institutions that run different hospitals. Hospitals run by the government of Delhi, hospitals run by the central government, hospital run by MCD, hospitals run by the army, and hospital run by private players. Therefore, as far as the hospitals run by the government of Delhi are concerned, I can say this with some amount of contentment that adequate arrangements have been made, and high-level meetings at the level of health secretary, divisional commissioner, local bodies and the health minister started way back in the month of April. Therefore, in order to politicize this issue, create fear and panic among people, the BJP and the Congress are trying to gain mileage. It is extremely unfortunate that they are behaving in such an insensitive manner.
I'm going to stop you there because I think it's important that that earpiece be put right so that you can then hear my questions. But I'll come back to you. The thought I want to leave the audience with, and unfortunately while your earpiece is not working, you can't answer it, is that many people believe that the government in Delhi got deflected with its problems with the Lieutenant Governor, with its problems with the central government, with its problems with its own civil servants, and as a result, your attention was not on the key priorities. But Sambit Patra, it's not just the Delhi government that is responsible for failing to plan for a peak year of dengue. The city's corporations come under the BJP. And today's Times of India points out that most resident welfare associations claim that fogging simply hasn't been done. Now, in a year when dengue was expected to peak, how do you explain the fact that fogging, a key preventive measure, hasn't been done in most residents' welfare association areas?
I'll give you a two-point answer to this, since I'm a doctor and I'm aware of the fact as to how dengue can be prevented and treated. First thing, I mean, Karan, you would agree to the fact that one of the most essential steps as far as dengue prevention is concerned is making the people of this city and the country aware as to how it can be prevented and where they should go if at all they are hit by dengue. Now, though I don't want to politicize the issue as to where the Aam Aadmi Party's government in Delhi went wrong and what was the role of MCD, number one, advertisement is number one as far as dengue prevention is concerned. In this, the governments have to urge as to what measures have to be taken so that the dengue does not spread. We have seen 526 crore being spent by the Delhi government for only utilization of Mr. Arvind Kejriwal. Did you, Mr. Thapar, see, you staying in Delhi, did you see a single hoarding anywhere in Delhi saying that if your child is hit by dengue, these are the 7 targeted hospitals where you should go?
You're absolutely right in pointing out that the advertisements of the type you're talking about haven't happened. But the question I asked you was about the failure of BJP-controlled corporations to carry out fogging and fumigation.
Yes,
that's a key preventive measure. It comes under the corporations and you haven't done it.
Yes,
you share the responsibility for failing to advance plan in a peak year.
You are right, and I have to answer this very candidly. Number one, let me take the example of South Delhi Corporation. The South Delhi Corporation, in fact, the department which is supposed to fog and look after this is the Malaria Control Department. And you would be astonished to know, because the Delhi government, Mrs. Walia is also here, ask her that her government as well as the Aam Aadmi Party government, both of them have not allowed recruitment of personnel into this department. Most of the department is vacant, and few people who are serving are on ad hoc basis, on contractual basis.
Mrs. Walia's government ceased to be in February 2014. After that, there was 49 days of Mr. Kejriwal, and then it was the Lieutenant Governor under your control. So if there are 105 vacancies for the Assistant Malaria Inspector in the South Corporation, as the Times of India reports, you had 9 months of Mr. Najib Jung to get them filled up. He was working under you.
Mr. Najib Jung cannot get it filled up, sir. First, the financial arrangements have to be made. You are aware of the fact the salaries of the Safai Karmacharis were not paid by the Delhi government.
But the Delhi government ceased to be after 49 days in February 2014. Thereafter, till February this year, you ran the Delhi government, you ran its finances through Mr. Jung.
No, but remember, Karan, these decisions are not taken by temporary governments, not through the Lieutenant Governor.
1 year government is not temporary.
No.
1 year of Najib Jung is not temporary. You kept extending it, you delayed the elections.
These administrative decisions of finances of importance are taken by permanent governments. And that's the reason as to why the Aam Aadmi Party government...
I've heard your explanation. Let's leave it to the audience to decide whether it's convincing, leave aside whether it's credible. Let's come, Dr. Sanjeev Bagai, to a second level of concern. The belief that hospitals in Delhi are turning away patients, and particularly, sadly, poor patients. As a result, at least 2 children have died because they could not get urgent treatment. I want to ask you a simple question. How can a hospital turn away a patient whose life is clearly in danger?
Yeah, Karan. I think what has happened with a 6 or 7 year old child is completely unfortunate. It's unacceptable. My take on this is that if any patient of any age group, more so a child because his circulation is so vulnerable in a proven dengue or a suspected dengue, is better kept in a hospital environment rather than being sent in a mobile ambulance, which very often is ill-equipped to manage critically ill patients. To send a child who is hemodynamically, that means in terms of blood pressure or circulation or breathing, who's compromised away from one hospital to another hospital, is clearly inviting death for that child.
Can I interrupt that?
A larger question of
may I interrupt that, Dr. Bagai? Given what you're saying, and you're being very honest and candid, is it not then virtually criminal, not just negligent, but virtually criminal of a hospital to shut its doors to a child in that condition? Even if you don't have beds technically, you can erect an arrangement in a corridor. It's not the beauty of the hospital corridor that matters, it's the life of the child that counts.
Yeah. I think in a current, what you said is very important. In a critical patient, the availability of an ICU bed is not important. Even an emergency bed can stabilize a patient. Now, there are certain statements being made that whether the patient was stabilized in 10 minutes, 20 minutes, 25 minutes. This is a ridiculous argument, because to stabilize a critical child, it takes very often hours. You can't just run in a little bit of fluids, do a little bit of cosmetic superficiality and dispatch the patient in an ambulance. Please also note that the ambulances have to be an advanced critical care level of ambulances to transport these kind of children, not just routine white vans which have a white color with a red flag on it. With regards turning away patients, every private hospital would tend to have a particular capacity of beds, a particular capacity of manpower to man the beds in terms of technicians, in terms of technical staff, nursing staff, resident doctors and consultants. Now, having said that, if a patient comes critical, my own conscience says I will not, I cannot, and I will never send a gasping critical child away from my premises.
Thank you, Dr.
Unless
Bagai.
and until I make adequate arrangements for that patient where I feel that the patient is clinically stable to be shifted.
So,
I
Dr.
repeat
Bagai,
again, I cannot shift an unstable patient.
thank you, Dr. Bagai. Your words are not just emotionally powerful, but professionally. They should be seared into the conscience of those hospitals that shut their doors on children who then died because they didn't get treatment. If anything, those hospitals didn't live up to the Hippocratic oath doctors are sworn to fulfill. But unfortunately, Dr. Agarwal, there's a second level at which, just like governments, so hospitals too have let down Delhi. Because at the end of the day, hospitals also would have known that dengue peaks every 5 years, that this was likely to be a peak here, and therefore hospitals themselves should have been administratively planning to make arrangements, extend facilities to cope with what was likely to be a crisis here. Clearly, they haven't done that. Clearly, they took it in their stride, which is why when the crisis started to happen, they came up with excuses like, we don't have beds, we don't have facilities. Aren't they negligent for not doing advanced planning themselves?
Let me explain that we at Indian Medical Association were aware that this year dengue may be different. There were reasons for that. One of them is, and it came out to be that the strain is different, it is dengue 4, and whenever a new strain comes, which happens 3 to 4 years later, number of cases will increase. Fortunately, dengue 4 is less dangerous than dengue 2. If it would have been a dengue 2, the catastrophe must have been much higher. Second is that we had meetings with the Department of Vector Control, Government of India, and we had a couple of webcasts for the doctors. We have been releasing guidelines. We have been having 2 sessions with MCD. All those things have done.
Dr.
But
Agarwal,
regarding
Dr. Agarwal,
hospitals are concerned,
I grant that the IMA was on top of the ball, but the question I asked was that there is also a responsibility on hospitals to plan in advance. What did they do?
Hospitals, absolutely. Hospital needs to plan. What hospital needs, what a private sector needs when a patient comes. A, to attend the emergency immediately. B, to triage whether this is a single dengue or whether it is a severe dengue. Single dengue need not be treated, need not be given admission. They can be treated in outpatient. Third, to stabilize the patient by giving 20 ml of fluid per kg immediately stat. And after that, to look for the parameters. If the respiratory rate comes down, if the PO2 becomes normal, blood pressure becomes normal, then to either discharge or admit
Dr.
or
Agarwal,
safe transfer.
I'm interrupting again. Forgive me. I'm not talking about the treatment of dengue. Dr. Agarwal, I'm not talking about how you treat dengue. I'm talking about the fact that hospitals would have known this would be a peak here. Those hospitals should have already begun expanding their facilities. They should have had the beds, extra beds ready. They shouldn't have been saying when the crisis hits them, we don't have the beds. Why did they not plan for this? Why did they not plan for this?
Karan, I'm saying, no, most of the hospitals have planned, most of the hospitals had extra beds. Everybody was aware this is happening. But I am only trying to say is, every panic, number of unnecessary admissions gets increased, because every public will come back and say, admit me, admit me, admit me. The answer is very clear. Every patient of dengue doesn't need admission. Do not fill beds with patients who can be managed with an OPD care. Only admit those patients so that serious patients is not denied the
In
bed.
which case, if
Let's
hospitals were admitting the wrong patients, once again they are responsible.
Only concentrate with
but
the
once
message to
again,
the public.
Dr. Agarwal, if hospitals are admitting the wrong persons, only hospitals are to blame. The patient is not going to know whether he needs admission or not.
No.
Patients panic.
As on today,
doctors and hospitals should decide that if they're admitting the wrong patients, that again means they're not planning. And secondly, they don't then have the room to take in those needed.
No, when I am trying to say triage means when the number of cases are higher, then you need to admit more serious cases and not the less serious cases. When the patient can be managed, if the patient is not vomiting, if the patient is not having severe nausea, if the patient is not having abdominal pain, no bleeding,
okay, but it's not how you treat that I'm going into. Dr. Agarwal, it's not the treatment I'm going into. I'm talking about the absence of clear thinking and planning in advance, because this was known to be a peak year. Let me bring in Professor Lakshmi Narayanan. Professor Lakshmi Narayanan, I'm going to Professor Lakshmi Narayanan.
Even the government.
Dr. Agarwal, I'm going to someone else. Professor Lakshmi Narayanan, you're Vice President of the Public Health Foundation. These are issues that you and your foundation constantly think about. As I hear the conversation this evening, I'm talking about the admissions and lapses by politicians. I'm talking about the admissions and lapses by hospitals and doctors. What emerges is that, in fact, two elements lie behind the present crisis. Firstly, a lack of sufficient attention to healthcare in general and particularly for the poor. And secondly, a lack of advanced planning and thinking, even though we knew this was going to be a peak year. So both the general deficient situation of health in Delhi as well as the absence of planning when it's a peak year and you know it's going to hit you hard, both of that together has combined to create the crisis. Would you agree?
So Karan, the bad news is that after all these years, folks like us show up on TV every September as if this was a brand new event to talk about dengue, whereas this is a seasonal event where I go back on TV, everyone does, to go talk about dengue every September as if this was novel. The prevention of breeding of mosquitoes, all of this should have started way back in June, July. We had, good rains in Delhi. That was the point to have started the entire exercise. So I think while you're talking about treatment, for me the concern is that we have just not focused on prevention. One spoke about the need for educating people about not letting stagnant pools of water, Aedes aegypti only in clean standing water. Why have we not communicated these to people so that people don't take dengue as an unusual occurrence every year? That's number one. The positive side is you've got members of political parties sitting there at least arguing that they are trying to do a better job on health. For me, that's a positive sign, because at least they're arguing about doing something on health, which we haven't seen in many, many years.
Yes.
And what I'd like to see
But Professor Lakshmi Narayanan, they're only arguing, they're not acting. There's a big difference between arguing and acting. Words are easy, action is missing. And the sad part is this was a year when we knew dengue would peak, and our politicians didn't plan for it, and our hospitals didn't plan for it. And worse still, we have cases where young children have been brought clearly dying to hospitals, and doctors have turned them away on the specious grounds that they don't have room. You heard the very powerful way Dr. Bagai actually spoke out. So would you accept our entire attitude as a society to health and health issues, coupled with our failure to plan in advance when we know we're going to have a problem, that combination is what's hitting us badly today? Would you agree with that?
So Karan, it can't be news only to you that this is not just dengue issue. If I had a child with a heart problem and I showed up in a private hospital, I wouldn't even get to see someone like Dr. Bagai. I would probably, if I couldn't afford it, if I couldn't put 2 lakhs down at the front desk, I wouldn't get past the front door. So we're talking about dengue, but this is a persistent problem in health. Private hospitals cannot deliver health to the point where, which a government system really needs to deliver.
But I take your point. This is a reflection of a much bigger problem that afflicts our health situation. But let's stick to dengue rather than broaden the subject and lose focus. Raghav Chadha, let's come to what you're now going to take, because clearly essential immediate steps are necessary. Now, your Chief Minister has announced, and your Deputy Chief Minister has sent SMSs this evening asking every parent to ensure that children go to school with long sleeves, with trousers. Your Chief Minister has also announced that he plans a special session to give the government increased powers over hospitals so that they can give them penalties or they can even take over management where hospitals are seen to be lax. But the second is not something you can do in days. It may take you a week or 10 days to do. You haven't possibly got that much time. The critical period begins mid-September to mid-October. What are the immediate steps you plan? Give me 2 or 3 if you've got them in mind.
Yes, please give me some time to respond, Mr. Thapar. As far as the preparedness of the government goes, as I've already said, that directives were issued to all hospitals asking them to increase the number of beds and be well equipped for a season where there will be widespread of dengue.
When was that directive issued?
These directives were issued in the month of July as well as in the month of August, and in the month of August, 28th.
Did you then monitor and check what response that directive had got?
Yes. So,
you did. You monitored it.
As far as the hospitals run, no, I'm responding to your question. Allow me to complete. As far as the Delhi government-run hospitals were concerned, the capacity of hospital beds was increased by 3 times, and another directive in the month of August 28th, August 2015 was issued.
The past.
Asking all these hospitals.
Raghav Chadha, what are the immediate steps you plan now for the next 4 weeks? Come to that because we are short of time. What are the steps you plan now?
It is important for me to highlight, Mr. Thapar, because a picture has been drawn on this
Raghav
show by
Chadha,
other panelists
highlight the steps you plan for the future.
Was not well equipped.
Highlight the steps you plan for the future. Give me 3 of those that you plan now.
Yes. So as far as the planning for the future goes, we have increased the number of beds by another 1,000 in the last couple of days. We have issued advisories, guidelines.
Has that been done or has it only been suggested?
It was suggested on Thursday, and only
so clearly it hasn't happened as yet. So clearly it hasn't happened as yet. These things don't happen in 48 hours.
Allow me to complete. No. The health minister categorically said that I am giving you a time frame of 7 days to increase the hospital beds by 1,000. So I am assuming some of them have already been added and some of them will be added by Thursday.
Okay, what's the second step?
Point number 2, as far as the action on these private hospitals goes, the government of Delhi has not just issued show cause notices asking them as to why should their license to practice not be cancelled.
Just a moment. That is not a step that's going to tackle the dengue problem. That is an administrative issue in terms of penalizing hospitals, and it's good action which needs to possibly be taken. I'm asking you, what meaningful steps are you taking now to tackle the dengue problem? Punishing hospitals is not the answer.
Yes. So Mr. Thapar, the steps that the government was taking and will be taking goes as. First of all, the medical tests in the government of Delhi-run hospitals have been made free of cost.
Number
Medicines are being made available.
We're short of time. Please speed it up. Number two. Yes. All the MLAs of the government of Delhi and the belonging to different parties also will be going to every hospital of their locality and checking at least twice a day whether facilities, equipment, etc. I'm pushing you on. I want others to come in. Number 3.
The leaves of doctors, paramedical staff, etc. have been cancelled, and all of them have been asked to come and report urgently because there is a situation which we need to bring under control.
All right, Sambit Patra, let me bring you in at that point. Because Sambit Patra, a lot of the work that needs to be done to tackle dengue getting worse. And remember, we're into that critical period between mid-September, mid-October when it'll get even worse, has to be done by the corporations. What steps do you plan between now and the middle of October to A, ensure better fogging, and B, to ensure better education and awareness? That is as much a responsibility for the corporations as the government. So tell me what you plan to do.
A, relentless fogging is going on. Extra people have been brought into the department of the fogging.
Where is it going on? The paper says it's not happening at all.
House coverage. It is all, no, it has already started. I have authentic documents to back my claim.
When did it start? When did it start? When did it start?
It has started approximately 2 weeks ago, and the paper that you are telling, in fact, was the paper which presented with the fact that none other than the Rashtrapati Bhavan was the one which had to pay fines, because Rashtrapati Bhavan, it was found by the NDMC,
Unfortunately, India doesn't live in Rashtrapati Bhavan. The Indian people do not benefit from what happens at Rashtrapati Bhavan.
Not even the Rashtrapati Bhavan was spared. Not even the Rashtrapati Bhavan was spared.
What else do you plan to do beyond extensive fogging? Tell me that.
Relentlessly, the Union Health Minister, Mr. J.P. Nadda, is in contact with the Health Minister of the Delhi government, and he has said that no politics, please. Whatever you need, we are there by you.
That's just words. He's picked up the phone and spoken to his colleagues and exchanged words. That's not going to help the dengue situation on the ground.
541 sentinel surveillance points. 541 sentinel surveillance point where the NS1 test, that is the IgM test required for dengue, is being conducted by the kit provided by the central government. This the Delhi government knows as well. So anything that the Delhi government needs, please don't go into politics. We are there with you.
No, we're not going into politics. I'm asking you to give me specific answers about what your Delhi corporation's plan
I'm asking the Aam Aadmi Party not to rush into politics.
All right. If you seem to have answered what I asked you, let me come to Mrs. Walia. Mrs. Walia, I deliberately left you to answer after Sambit Patra and Raghav Chadha, because unlike them, your party was in power for 15 years in Delhi. You have handled dengue, therefore, for 15 years. You've handled at least 2 peak dengue years. What you've heard both the BJP and the Aam Aadmi Party say, is it sufficient for what is now needed in this critical month?
I'd answer that. You see, what they did not do was having a coordinated effort. What is required is immediate coordination, and that's what we did. Had private hospitals on board, including Dr. Trehan and otherwise everybody attending meetings, had central government hospitals on board, had MCD on board, had even National Disaster Management Authority, because they have their own tools and instruments to address these issues sometimes better than MCD, and it is not fighting with each other, but it was putting them all on board, and that yielded results. Believe me, when Mulchand and Max and Apollo put up wards, dedicated wards, at our instance and request within a fortnight.
So basically what this government hasn't done is to contact a whole range of people, private sector, private doctors, and to a coordinated effort.
Yes.
So that is your advice both to Sambit Patra and Raghav Chadha. Spread your net wider.
They'd have a larger picture about the number of beds available. Secondly, what the health minister has even come out today is not like a misguided missile that everybody should be admitted in hospital. Out of the 526 crores, something needs to be spent on giving a proper advisory, go to schools, do everything, you have leaflets and everything done. Is that now a panic button is being pressed? It's very important not to have the unnecessary rush in hospitals and unnecessary admissions.
So better advice to patients, better advice to parents, how to respond if their children or if they themselves get fever.
Exactly.
Let me bring you in, Dr. Bagai, because when we talk about advanced planning for the critical 4 weeks coming, and the reason why those critical 4 weeks are critical is because dengue always peaks mid-September to mid-October. The hospitals too need to plan for this period. What is your advice to Delhi hospitals, whether they're government-owned or privately run? What planning do they need to do to ensure that we are adequately equipped and we have adequate facilities for the critical 4 weeks ahead?
I think this is the most critical part for the next 2 to 4 weeks. I think rationalization of our resources, be it as hospital beds, government or private, and manpower, be it technical, nursing or doctors, needs to be done. We need to have a more active public awareness campaign, patient education campaign, and lastly and most importantly, even now mosquito breeding is going on, proper sanitation and drainage system of Delhi must be attended. Karan, I'm repeating it again. Every year we will have these programs. We are seeing only the manifestation of the disease. The disease is poor infrastructure and poor sanitation. Unless until that is not corrected, we will have waterlogging, we will have mosquito breeding,
Dr. Bagai,
and next year again we will have an outbreak of dengue.
Sanitation and waterlogging may not be things that can be tackled in the next 2 weeks. What is it that hospitals can do to prepare themselves with the facilities, with the equipment, with the doctors, with the nurses needed in that critical 4-week period? Give me a short, sharp answer to that, focusing on hospitals.
Yeah, my take is to rationalize the manpower, rationalize the beds, have more number of outpatient clinics in which you can decompress the hospital rather than it being overflooded. And again, I repeat, all patients of dengue, almost 90-95% of dengue patients do not require admission. They require bed rest, they require paracetamol and good hydration at home.
Very quickly, Professor Lakshminarayan, I want to pick up on what you heard Dr. Bagai say, that hospitals need to have bigger, wider outpatient clinics. In fact, the question I want to put to you is this: has the time come, particularly when we talk about the critical 4 weeks ahead, when dengue really does seriously peak, and this being a peak, it will be much worse this time than it's been previously. Do we therefore need small, accessible, community-based medical clinics where people can go easily if they get fever, to find out whether it is dengue, to be told what to do if it is dengue, to be reassured if it's not? Do we need more local, community-based, easily accessible medical clinics to be set up?
Absolutely. So there is talk of fever clinics, and there are also at the same time there's a typhoid epidemic. There are other febrile illnesses at work right now. So rapid detection to identify those with dengue and treat them appropriately, and I fully agree with Dr. Bagai on triaging so that we are able to get at the most severe patients first. That is essential. However, on the prevention part, it is not as dire as you think. Turns out that Aedes aegypti only breeds in clean water, not in dirty water, which means that much of the breeding is happening in overhead tanks.
In other words, are you seriously suggesting, in other words, that all stagnant water should be dirtied immediately? Pools of clean water are a danger. Dirtier water, it's a protection, even if it sounds bizarre.
No, we have larvicides. We have the mechanisms to deal with this. So I don't think this is rocket science. We've had these for at least 100 years, and the corporation or the Delhi government just needs to get these out right now, in addition to also setting up more fever clinics and doing rapid detection.
All right, we're going to take a break at that point. When we come back, we're going to focus in the limited time available on that very tragic set of cases that have happened in Delhi over the last 3 days. 2 children being turned away from hospitals when clearly they were dying. And hospitals declared that they didn't have the room, they didn't have the equipment, they didn't have the facility to treat them, when all it required was to give them not necessarily an ICU room, but just a small bed to stabilize them, and you could have saved their lives. We're going to turn to that after the break and ask.